Oh, 'tis the season for viral outbreaks, and federal health officials are warning of the spread of a common stomach bug, medically known as Norovirus. Our medical contributor, Dr. Michael Daignault, is here with what you need to know. Happy New Year to you.
Happy New Year.
Yeah.
Good to be back.
And we'll talk about it at the end, but this is your 2-year anniversary with us.
2 years of being with Fox LA, yes.
We'd love to have you here.
Thank you.
Okay, so Norovirus, a lot of people I've seen on my social media have said, I have food poisoning,
right.
But there's a massive spike in Norovirus, and the two can be confused?
Yeah, it's probably not food poisoning. It's probably Norovirus. We're seeing very high levels of Norovirus across the country, much more than in previous years. Patients are filling up the ER with this, especially after travel over the holidays and things like that. And the concerning thing with Norovirus, it's considered the perfect pathogen. So normally when you talk about viruses, they're surrounded by an envelope that's made out of fat. And that fat can easily be broken down with like Lysol spray or alcohol-based hand sanitizer like Purell. But with Norovirus, it has a protein capsid that's resistant to Purell and that disinfectant. So what we really want people to do is wash their hands for a full 20 seconds because it's that friction, it's that trauma between your fingers that will break down that capsid and destroy it.
Okay, so hand sanitizer does not work with the Norovirus.
No, you got to use bleach to clean your surfaces. Okay. And just the soap and water. It's the physical rubbing of the hands that is going to do the trick.
And the symptoms may be obvious, but I think it's worth sharing what those are.
So it's just acute onset, stomach pain, vomiting, diarrhea, and then plus the traditional flu-like symptoms. So the fevers, the chills, the body aches as well.
Okay. And do you go to the ER when you have this presented?
Yeah, that's a tough one. So if you're really losing a lot of volume, whether from the vomit or diarrhea, you're not able to keep water down, things like Pedialyte, electrolytes, and you're feeling very weak, you're not making urine, which is a good sign to show that you're dehydrated. Especially the very young or the older patients, they should probably go to the ER, not waste much time. But if you're younger, you're healthier, you should try to, just try to replenish as much as you can. And the symptoms usually only last about a couple days.
Okay, a couple days of H-E-double-L. Yeah, misery. Okay, so we've been talking a lot about the bird flu, right? So the CDC reported last week that genetic testing of that Louisiana patient with severe bird flu has several mutations. What does this mean? Why is this concerning?
So, we've been talking about this for the last few months, and what I was really concerned about this particular case that the CDC studied was that in this patient, in their sampling of the virus they had multiple mutations which showed that the virus had evolved already to get into human upper airway and cause infection. And so that was the first thing that was concerning. The second thing, that when they looked at the infected bird on that patient's property, that bird didn't have those mutations. So these mutations occurred in that patient during their hospitalization of their illness. So the virus is very smart. It's able to evolve that quickly. And we've never had H5 cause a pandemic. But, worst case scenario would be somebody that has traditional flu, works on livestock, dairy, gets infected with bird flu. The two viruses in the patient at the same time mutate. It evolves the ability to spread from person to person. That's what we don't want. That's why I've always said here multiple times, anytime we give the virus a chance to infect a human, even if it's just mild symptoms, you risk the chance for this viral evolution. And that's what's really concerning. But, we've been prepared for this. We have about 4.8 million vaccines already created and stockpiled, particularly for bird flu. And we know that our antivirals like Tamiflu that we use for flu do work. Okay. So it's definitely not a position, like we're in with COVID where it's a completely new pathogen. I mean, we are prepared, but, I'm nervous. This has made me very nervous, this particular case. Okay,
well, and then we had the LA County case as well, right. With I believe it was a male who worked in livestock, and he tested positive for the bird flu. Right. And then just like in COVID, they did the outreach of the close contacts. And fortunately, that hasn't developed into anything else. Right. So that is good news. Okay, so we'll keep a watch on that. So as mentioned, it's been 2 years since Dr. Daignault has been here providing us with this great service of keeping us healthy. What's been a highlight for you?
Well, do you remember our first case, the first time we talked, it was about Damar Hamlin.
Oh, wow, the football player who collapsed on the field during Monday Night Football.
Got CPR, got the AED to defibrillate him, and he came back and has been able to play. But that was on our first segment. And so, yeah, you think about how far we've come in 2 years.
We've talked about everything.
We've covered everything. I mean, we've covered the Trump assassination attempt.
Yep. You provided help when he was shot in the ear.
Yeah, the tail end of COVID, and you know, now bird flu, and it's just, you know, it feels like we've been one of the first stations to really be up in front and keeping track of this, and especially because California has the most number of infected dairy and livestock herds in the country, and so I think it's really important for us as an LA station to be on top of that. So. Okay,
well, tell people where they can find you on socials.
Yeah, Dr.Daignault on Instagram. Love to hear your questions, things that you'd want us to answer on air. We're here to take your questions.
Yeah, that's perfect. All right. Well, again, happy number 2.
Thank you.
Yes. Well, that didn't sound good. Happy second anniversary. Well, I guess to a doctor it makes sense.
Norovirus
it makes sense.
So.
Yeah, exactly.
Much more.